This presentation is on Prader-Willi syndrome, which is also known as Angelman syndrome. Prader-Willi syndrome is a genetic condition that is caused by an error in the 15th chromosome. The most common, which accounts for about 75% of cases, is when the paternal genes on the 15th chromosome are missing. The second case accounts for about 25 to 28% of Prader-Willi syndrome. This is when the child inherits 2 copies of chromosome 15 from the mother and none from the father. Finally, the third case is a deficit in activating the paternal gene on the 15th chromosome, which accounts for 2 to 5% of Prader-Willi syndrome cases. The overall prevalence of Prader-Willi syndrome is 1 in 15,000 people. Symptoms of Prader-Willi syndrome in infancy include poor muscle tone, low responsiveness, and distinct facial features such as a narrow forehead diameter, almond-shaped eyes, narrow nasal bridge, downturned mouth with a thin upper lip, and hypogonadism and a short stature. In childhood, an individual with Prader-Willi syndrome will have delayed motor movements, learning difficulties, and engage in overeating due to an insatiable appetite, which leads to obesity, causing a number of other health issues such as type 2 diabetes. Throughout adolescence and adulthood, individuals with Prader-Willi syndrome display poor growth, which is why growth hormone treatments are commonly seen. These individuals often have behavioral problems, sleep disturbances, and problems regulating body temperature. In regards to speech, language, and communication in individuals with Prader-Willi syndrome, there are many factors that contribute to their difficulties. Every individual with Prader-Willi syndrome has limited intellectual abilities which affects their expressive and receptive language. There is typically greater difficulty seen within their expressive language abilities. As mentioned in the previous slide, individuals with Prader-Willi syndrome have low muscle tone, which causes a slow rate of speech, changes in voice quality, and difficulty coordinating their movements to produce speech sounds. All of this results in the person being unintelligible. It is also common that these individuals are nonverbal and use alternate forms of communication such as signing or AAC devices. Relative strengths for these individuals are their vocabulary knowledge and reading decoding as well as their reading comprehension. We have inserted this table to help you better understand the link between clinical features of an individual with Prader-Willi syndrome and the effect each feature has on their speech and language abilities. For example, the behavioral disturbances, such as temper tantrums, is a clinical feature that impacts their social use of language.
Patients with Prader-Willi syndrome often have feeding and swallowing disorders. In infancy, an SLP is often one of the first professionals to work with babies with Prader-Willi syndrome due to poor feeding ability. However, around age 2, the feeding and swallowing disorders are followed by uncontrollable appetite and lack of satiety. This leads to most patients with PWS being obese. Many clients are also unable to produce a sufficient amount of saliva, leading to severe dry mouth symptoms. Studies have shown a link between restrictive feeding and more severe psychosocial and behavioral problems for children with Prader-Willi syndrome compared to their non-syndromal obese and normal weight peers. No drugs have proven effective in an effort to gain control of the appetite. Here we have compiled a list of professionals commonly seen on a team for a patient with Prader-Willi syndrome. Each professional plays a vital role in the treatment of the disorder and working towards the most functional life for the individual patients. Note that an SLP is not commonly found on the team for an adult patient with PWS, as the feeding and swallowing disorders have likely been resolved. Please watch a short clip of an example therapy session for a child with Prader-Willi syndrome.
Hi, today we are with Abigail. She's 8 years old and she has Prader-Willi syndrome. She's also nonverbal. And today we're working on 3 goals. We have eye contact, decreasing tantrums, and engaging in appropriate book reading. Typically, Abigail can engage in appropriate reading for about 3 minutes before she has a tantrum. So we are working on increasing that to 5 minutes before she has a tantrum. Good morning, Kitty. It's your birthday. Would you like something special for breakfast? Kitty wants A. Can you show me what's under A? Abigail, show me what's under A. You need to point. Abigail, remember the skills we're working on today? We need to really focus on our reading. Abigail, Show me A. We'll put those over there until we're all done with our book. Abigail, we need to follow directions and listen to the book. Abigail, look what I have. Should Mr. Hippo read the story with us? I know you like Mr. Hippo. Here, would you like to hold him while we read the story? All right, let's read with Mr. Hippo. Maybe Mr. Hippo can point to the pages. Can Mr. Hippo point to B? Good job, Mr. Hippo. Can Mr. Hippo point to C? Nice job. Sorry, Kitty, I don't have any of those things. Is there anything else you'd like to do for breakfast? Kitty wants, what's under E? Can you show me what's under E, Mr. Hippo? Right here. Elephant. What's under G? Geese. Nice job, Abigail. I love how you're listening, using appropriate eye contact, and reading with Mr. Hippo.
Some expected outcomes from therapy and treatment include the ability to enhance the individual's communication, comment on objects, and enhance pragmatic skills such as requesting appropriately, greeting others, and using appropriate eye contact. Positive behavioral support techniques can be used to help provide the child with positive ways to release frustration instead of throwing a tantrum or resorting to other forms of behavior. Growth hormone therapy can be used to increase mobility, lean mass, height, speech, and abstract reasoning. This type of therapy usually begins when the child is diagnosed with Prader-Willi syndrome or during infancy and continues throughout adulthood. It also has been known to improve the individual's sleep quality. Here are some helpful resources for families and professionals so they can learn more about Prader-Willi syndrome. The first resource you see here provides an overview of what Prader-Willi syndrome is, some symptoms, causes, and prevention methods. The second resource provides a description of the diagnosis, provides information on how to manage Prader-Willi syndrome, and also additional resources for families and professionals to look at in order to learn more information. Thanks for listening to our presentation on Prader-Willi syndrome. We hope that this presentation has been informational and has given you a good idea of some of the important aspects of Prader-Willi syndrome.